Hi, this is Dr. Christopher Maloney talking to you about dandruff. Now, dandruff is not something anybody would really come into a doctor for. It's basically something that's treated primarily by over-the-counter shampoos. If you're going to get over-the-counter shampoo, I'm sorry to say this, but for the most part, Head & Shoulders really loses out to other products. I think even the Selsun Blue group loses out to these guys. If you look at the medical studies under dandruff, what you'll see is that there's a couple brands that really do well, and they have an antifungal component. The Head & Shoulders uses, I think, a zinc. It's not as effective unless you're really zinc deficient for some reason. But the dandruff is really, it's one of the least difficult aspects of kind of an overall picture of eczema, which is just your skin is not doing what it needs to be doing. And so your dandruff, for those of you who have dandruff and are reading or watching this, really think of it as the beginning of an issue. It's not something that you just treat with a shampoo and move on. It's something that you should look at and say, well, what is happening in my life that leaves me susceptible to this, basically a fungal infection of my head? And what do I need to do to alleviate that now, and not just from a shampoo standpoint, but from a what is going on in my life standpoint. It's really a kind of one of those little minor wake-up calls. Not everything's where it needs to be.